Okay, let's go ahead then and get started. This is recognition of child abuse and neglect, and I'm Dr. KRoling. I'm the Chief Education Officer here at Dental CE Academy. I'm a public health dentist in Phoenix, Scottsdale, Arizona, and I have practiced 35 years, retired from clinical practice. Recently, I was the chief for the Office of Oral Health for Maricopa County's Public Health Department. So I have some experiences to share with you today, and I like to make this course interactive as much as possible. So I'll be asking for feedback from you all, and hopefully you will join in because it just makes the course that much better in terms of learning for all of us. So this is a training program that was developed to help clinicians recognize some of the signs and symptoms of child abuse and neglect. I will address the reporting process. I'm also going to address preparation. Educational objectives are in your handout. So the problem that we have here from the child's view is that over 3 million children are abused or neglected in the US every year. As many as 1,500 reportedly die from the abuse, but the prevailing thought here is that that number may be very, very misrepresented or underreported by about 50%, because it's often difficult to tell the cause of death in some of these cases. So they may not have been identified as the result of child abuse or neglect. Average age of an abused child is 3 years. You're going to see that on the quiz. All right. And again, difficulty often occurs by not being able to determine necessarily the cause of death in these cases. And unfortunately, these numbers are on the rise. Now, we are all considered mandated reporters, and we'll talk about what that definition here is here in a minute. But for the mandated reporter, filing a report of suspected child abuse or neglect can be very difficult. And I've had to do it hundreds of times. Here in Maricopa County, our programs were very, very large. In fact, our sealant program, our fluoride varnish program, our maternal oral health program, all three, probably the largest in the US. We serviced over 450 schools across 23 school districts, and that was just in one county. And we're talking about a county that's desert, mountain, and everything in between. So I would get these cases that were sent to me on a daily basis. I had hygienists out in the field, evaluations, placing sealants or fluoride varnish, and they every once in a while would come across the case that they were concerned about. We were using telehealth at the time. And occasionally, we also worked very closely with the Arizona Department of Health Services. And they had their program coordinators that would follow up on these evaluations that we did. We would refer these children to them to help place them with a pediatric office. And if these children didn't show up or there were other forms of strife, they would give me a call and they would say, Dr. KRoling, what do you think? Is it time to file a report? And so, again, I had to go through hundreds of these cases. And I can tell you that not one of these cases was easy for me. Not one. There are some cases that still haunt me till today, and I'll explain that to you. I do want to remind all of you here on the live presentation that you should be using Chrome. So if you're not using Chrome, you may experience audio or video fallout. Okay. So why is it that mandated reporters have such a problem filing a report of suspected child abuse? Where is the angst? Well, concerns about how the suspect may react, concern about what the outcome could be. Is the child going to be taken from their home? Questions about whether or not the report would put the child at greater risk and then just in some cases, lack of knowledge. But I have to tell you that the number one message I want you all to take away today is preparation. Because if you practice long enough, you are probably going to come into some experience with child abuse and neglect. And what you don't want to do is be reactionary. It's very stressful as it is. So I know some of you are here individually. It's not your entire practice. And my recommendation is that your entire practice take a course, whether it's this one or other courses, and then formulate a plan. And what is that plan going to look like? Well, if you believe there is a case of suspected abuse or neglect, who are you going to call in your jurisdiction? Child Protective Services, your local sheriff, etc. So homework number one is find out who you need to call, and pick up the phone, introduce your practice, let them know you are a local dentist. You want to have that preparation in the event that for some reason you may have to file a report. And they're also going to help you. They're going to walk you through the steps as well. So number one is find out who is in your jurisdiction when you file the report. Assign someone in your practice that would actually call to file the report. So whether it's the dentist, the treating dentist, or the hygienist, if someone needs to call the police, who is that person going to be? Where are they going to be calling from? And then if somebody's going to show up at your dental practice, are they coming through the front door where your patients may be sitting? Or are they coming through a side or back door? So these are just a couple of the things that you need to think about. And we're going to be talking about more as we go along. So again, preparation is the key to minimizing this stress, this difficulty of reporting suspected abuse. So be fully prepared. I also recommend that maybe once a month or once every couple of months, you have sort of a rehearsal during one of your all staff meetings. Pretend that a patient walks in, pretend that they're with perhaps an abusive or suspect in your practice, and everybody has a role. So as we said, lack of reporting can often be due to lack of knowledge. And this was a cross-sectional survey of general dentists concerning child abuse. And we're going to talk about it in a little bit more detail here. What do we know about dentists and their perception of mandated reporting requirements? And again, we know knowledge is power. If you have the knowledge behind you in terms of how to file, when to file, and these systems in place, it's going to serve you well. So we know that child abuse continues to be a social menace that causes physical and emotional trauma to children. 50 to 75% of child abuse cases include the areas of the body, shoulders and up. But dental professionals, we know, are in a unique position to identify physical and emotional manifestations of abuse. Now, this was a cross-sectional survey, as I said, 20 questions, 120 state licensed dentists, and lack of knowledge was the number one reason for their hesitancy to report. They were either misinformed or not informed, and this, again, was their number one reason for not reporting, that accounted for about 55% of cases not reported. So there was no statistical difference between female and male dental clinicians. And although the respondents were aware of how to diagnose child abuse, or they felt confident about diagnosing the physical signs of child abuse, they were hesitant and unaware of the appropriate authority to report. Now, the first documented evidence of dentists failing to report child maltreatment was reported by the American Dental Association in 1967. It was among 416 reported cases of child abuse in New York, none reported by a dentist. And the lack of knowledge by the dentist in this area, again, was documented as the reason for that case of underreporting. When they looked at the attitude of dentists towards reporting child abuse, who would they report to? 46.3% to the police, 25.9% to the parents, 26.9% to a child line help number, 0.9 to others. Those that believed their legal obligations to report suspected cases of child abuse, 39.6, diagnosed cases of child abuse, 53.8%, and 6.6 did not know. And then barriers to report. So reasons for their hesitancy: lack of adequate history, 42.1%, lack of knowledge about the dentist's role in reporting, 43.9%, and concerns about the effect it may have on their practice, 14%. Now, when we look at reasons for hesitancy here, lack of adequate history, those of us in dentistry are fact finders, right? We need to know the details. We want to investigate. We need to make sure we are correct 100% of the time. It's difficult for us to not be correct. And we can't always be correct when we file these cases. We might be wrong, but we're required to report anything that is suspect. And we are not required to be detectives and investigate. Why? Because we're not that good at it. There are professionals out there that can do a much better job than we do. So the law enforcement requires, or actually, I don't want to say requires, depends on us. If we see something that's suspect, or we hear something that a child actually identifies that they've been abused, we have to report it. We can't call the neighbor to see if it actually happened. We can't call the kindergarten teacher and verify necessarily. We have to take it for its word. And we're going to talk about things are circumstantial. They're not always black and white, right? Sometimes we're going to report and sometimes we are going to be wrong, and that's okay. It's when we don't report because we're afraid of being wrong and more children become hurt, or God forbid, lose their life because of our inaction. That's when we have a problem. All right. So again, the laws are actually written for us to over-report because they know otherwise the tendency is to under-report. So again, we said lack of knowledge about the role in reporting here. 51.4% was identified as the major barrier in reporting, but only 14% were apprehensive about its effect on their practice. So we have to be knowledgeable about reporting requirements and the process that is triggered when a report is made. And again, that gets back to having as few surprises in our day as possible, right? So being prepared. It requires a team effort. So I know the majority of you are here individually. It may be a requirement, etc. But really, it requires the dental practice to be in sync. You have to have a preparation, just like if a patient had a medical emergency in your practice. What's the drill? What do you do? These situations with abuse and neglect where you may have a perpetrator in your practice are high stress. Those potential abusers or perpetrators, they are stressed. They don't want to be there. They're bringing that child in for a reason. They may have delayed care because they don't want to be found out. We'll talk about that. It can be a very high stress and in some cases, a dangerous situation if you are not prepared. So responding to suspected child abuse requires a team effort. It involves preparations even beyond our practice. Law enforcement, as I said, medical personnel, mental health professionals, and more. If anyone has any questions or comments, please be sure to type them into the chat area. So we're talking about mandated reporters, and we are mandated reporters. We are individuals that are required under penalty of law to report any child under our purview suspected of being abused or neglected. And although dentists are considered mandated reporters, the data shows us that we tend to report less than 1% of all abuse cases. Now, it's important to understand our protocols are laws, etc., and all issues that are specific to practicing dentistry. When you relicense, in many states, you are signing an affidavit. You're signing an affidavit that you completed the required continuing education courses. You're signing an affidavit also in many states that states that you understand you are a mandated reporter. You understand what the laws are and that you will file reports to protect the child. So it is part in many states of your licensing. When you are in doubt about a particular situation, you can contact your local child welfare agency or law enforcement as well. So you don't have to practice in a silo here, but I hope that will give you enough information today that you would feel confident in the case that you needed to file a report on what to do. All right. So dentists are mandated reporters of suspected child abuse and neglect. Again, the problem here is that dentists report less than 1%. And to help prevent the growing number of these cases, every state has passed legislation to increase the reporting of suspected abuse and neglect. And these laws, again, classify individuals as mandated reporters. Any questions so far? All right, so we're going to talk about history here. And if you do have questions and comments, again, please be sure to type them into the chat area. There's a history around child abuse and neglect in this country it borders shameful, actually. And I was just reading somewhere about a photographer, and I'm going to incorporate it the next time I update this course. Last name was Lewis. And he took photos during the early 1900s and even late 1800s of child workers, children that were working in coal mines, on farms, agricultural work and so forth, who weren't going to school. The laws have changed since then, but the numbers of children that would become injured and work these incredibly long hours at that time was shameful. So a lot of our employment laws now are based on that time period, but we're going to see it took us a long time to get there here in the US. So let me talk to you briefly about the history. Child abuse and neglect certainly are not new to society. And Dr. Ambroise Tardieu from Paris, France, wrote the first scientific paper on child abuse in 1860, and he conducted a retrospective study of 39 children who died at, quote, the hands of their parents. And he said in this country, and he was talking about France, early attitudes toward child maltreatment seem to have been based on denying the very existence of abuse or neglect. It's really a difficult thing to think that an innocent child could be harmed, and it happens. And it's a great thing to know that we can actually be in a position to change that for these children. So this was the case of Mary Ellen in 1874. And we'll see that no mention of child maltreatment appeared in the literature until this time. And it was in that year that this case of Mary Ellen was brought to light. Now, a church social worker had been visiting a parishioner, elderly parishioner, and she learned about this child, Mary Ellen, who had been beaten, bound, and neglected by her foster parents. And the social worker found that there were no laws to protect Mary Ellen. She could do nothing to have the child removed from the home. So the church sought changes in the laws to protect these children. And this was Mary Ellen, and you can see the injuries on her legs. As a result of this case, it led to the creation of the New York Society for the Prevention of Cruelty to Children. And she was, again, as an 8-year-old, severely abused by her foster parents at the time, Francis and Mary Connolly. And this was her living conditions at that time. Following those legal efforts on behalf of the church to help Mary Ellen, the American Society for the Prevention of Cruelty to Children was formed. And her case was championed under the auspices prior to that of the American Society for the Prevention of Cruelty to Animals, because she was deemed to be a human animal and there were no agencies to help her at that time. And she went on to get married and she had her own children and she became an advocate for child abuse. All right, I spoke earlier here just a little while ago about the US child labor laws of the early 1900s that made some inroads into the prevention of child maltreatment. But actually for decades, almost 100 years, no other actions were taken to protect children. And this picture was taken in the 1900s, and it shows children who worked in a West Virginia coal mine. And these children would die. Many of them would die working in these mines. Now, Dr. C. Henry Kemp, in July of 1962, published an article. The publication was The Battered Child Syndrome in the Journal of the American Medical Association. And his message was that battered child syndrome should be considered in every differential diagnosis involving injuries to children. And he advocated that abuse should be considered in any child exhibiting evidence of any fractured bone, subdural hematoma, failure to thrive, soft tissue swelling, or skin bruising. And he later expanded the list of symptoms of child maltreatment to also include retinal hemorrhage, handprint bruises, human bite marks, genital injuries, intraoral hematomas, and lacerations of the mouth. And he stated in 1962 that unfortunately the battered child syndrome was not recognized, or if diagnosed, it's inadequately handled because of hesitation to bring the case to the attention of the proper authorities. And this article launched a firestorm, his publication. And because of the article, the problems of child abuse gained public recognition for the first time. So many magazines at the time picked up this publication and printed stories. Cry rises from beaten babies, the shocking price of parental anger and good housekeeping, and so forth. Further evidence of the effect of his article was that the Federal Children's Bureau authored model legislation in 1963 for the states to address the problems of child maltreatment. It was 1974 when the first child abuse reporting law was passed, and it provided funding to the states for development of child protective services and hotlines to prevent serious injuries to children. So the Federal Child Abuse Prevention and Treatment Act stated any recent act or failure to act on the part of a parent or caretaker that results in death, serious physical harm, or emotional harm, sexual abuse, or exploitation, or an act or failure to act which presents an imminent risk of serious harm. And the Federal Child Abuse Prevention and Treatment Act of 1974 provided dollars for research, demonstration projects, and the National Center for the Prevention of Child Abuse and Neglect, and Title 20 of Social Security Act of 1975. So it mandated that every state had legislation aimed at protecting children. Here's some data that I want you to take a good look at. This was in 2019, a total of 142,290 children aged 1 and younger. 1 and younger were abused in the United States. 2 to 5, 158,946. Current trends during the COVID-19 pandemic, you're going to see this on your quiz. Public health emergencies increase the risk for child abuse and neglect because of increased stressors and loss of financial and social support. And during the pandemic, the COVID-19 pandemic, the total number of emergency department visits related to child abuse and neglect decreased. That is a quiz question. However, the percentage of these visits resulting in hospitalization increased compared with 2019. And that's because the abusers, or whoever took the child to the hospital, was probably waiting until the child was too serious and had to be hospitalized, or the pandemic affected healthcare and seeking patterns for child abuse and neglect, raising concerns that the victims might not have received care and that the severity of injuries remained stable or worsened. Okay, there was an expansion of the term mandated reporters as knowledge and understanding of child abuse and neglect increased over time. It became evident that other professionals needed to be included to help identify maltreatment. And so this led to a substantial increase in the number of professional groups designated in state laws as mandated reporters. A child abuse prevention council or child protective agency, it is required that mandated reporters stay abreast of periodic amendments in the law. It's not just important, it's required. So if you had a situation where you failed to report and you said to law enforcement or the state attorney general's office or whomever was investigating this, and you said, well, you know, I didn't know the laws changed. That isn't good enough, because again, in many states, when you relicense, you are signing your name to an affidavit that states, I will stay on top of these laws. I understand that I am required. It's my responsibility to know what these laws are. There's a link for you to childwelfare.gov and all of the state statutes. So why must you report? Understand that the primary intent always is to report to protect the child, and protecting the victim or the potential victim may also provide the opportunity to protect other potential victims. It's also important to provide help for the suspected abuser. And the report of abuse may be a catalyst for bringing change in the home. And that may in turn lower the risk of abuse. So child abuse and neglect includes physical abuse, sexual abuse, including sexual assault, sexual exploitation, willful cruelty or unjustified punishment, unlawful corporal punishment or injury, and neglect, including both acts and omissions. Under the law, when the victim is a child, a person that is under the age of 18, and the perpetrator is any person, could be a child as well, the following types of abuse must be reported by all legally mandated reporters. Physical abuse, physical injury that's inflicted by others than accidental means on a child or intentionally injuring the child. Sexual abuse includes sexual assault, sexual exploitation for anyone under the age of 18, includes sex acts with children, intentional masturbation in the presence of children, and child molestation. It includes preparing, selling, or distributing pornographic materials involving children, performances involving obscene sexual conduct, and child prostitution. So neglect, when we talk about child neglect, we're talking about either severe neglect or general neglect. So neglect of a child, whether it's severe or general, must also be reported if the perpetrator is a person responsible for the child's welfare. So it can again include both acts and omissions that harm or threaten the child's health or welfare. And general neglect is defined as the failure of a caregiver of the child to provide adequate food, clothing, shelter, medical care, or supervision where no physical injury to the child has occurred. So that is considered general neglect. I'm going to give you an example. Here in Maricopa County, we have school districts that are below the federal poverty level. And actually, of the 450 schools we went to, they all had to be below the federal poverty level. And in some of those school districts, the very, very poor school districts, children would show up, in the morning without shoes or no coat, etc., or the same dirty clothes that they had been wearing all week. Now, but their parents were getting them to school. So some of these schools, what they did through their parent teacher association and so forth, they would have ways to do laundry on the premises. They'd have a washer and dryer. They kept extra clothing for these children. They kept extra shoes and coats and so forth. And that was really considered general neglect. I mean, if your child shows up at school in flip-flops, and here in the desert, it gets pretty cold in the wintertime, and it's, freezing outside, that's a failure to provide adequate food, right? But the schools also understood who their students were and who those students' parents were. So they met them halfway. And that was the best they could do at the time. Again, no physical injury of the children occurred. But severe neglect means the intentional failure of that caregiver to provide adequate food, clothing, shelter, or medical care where injury has occurred or is likely to occur. So severe neglect can include those situations of neglect where the person who has the care or custody of that child willfully causes or permits that child, the health of the child, to be placed in a situation that it is in danger, right? So severe neglect, again, would include lack of medical care. And we'll talk about that, lack of dental care. So mandated reporters include medical professionals, of course, dentists, etc., chiropractors. When do you report? You need to report immediately when you have the knowledge that the child has been abused, or you believe reasonable suspicion that they've been abused. All right, so this is called reasonably suspects and reasonable suspicion. So reasonable suspicion occurs, and it's very lengthy, but I'm going to boil it down here for you in a second. When it is objectively reasonable for a person to entertain such a suspicion based upon facts that could cause a reasonable person in a like position, drawing when appropriate on his or her training and experience, to suspect child abuse. What does it mean? It means if you suspect, you need to report it. So let's say you would ask yourself, would my colleague, a dentist or hygienist, if they were here, would they report this? Right? That's one way of thinking it. The way I think of it is, look, when I have to start having a conversation with myself, when there's a little voice on my shoulder saying, did I really just hear that? And I want to try to second guess it, it's better to report it. And we're going to talk about having the conversation perhaps with the person that brought the child in versus the child and so forth. And again, it's not an easy situation. Every case is individual. Every case is individual. So again, the reports must be made immediately or soon as practically possible. You can pick up the phone. That's why it's important to know who is in your jurisdiction. Do you have that phone number at your front desk? Do you have that phone number in your business office? You want that phone number handy. And again, I would make the recommendation, if you haven't done so, to call these agencies and introduce yourself. Find out what's going on in your community, and ask them, find out who is in the agency and find out who some of the names are, so that you feel more confident when you're calling with a problem or you're calling to file a report. Now, they will have forms, and somebody is going to take your report over the phone as well. The report is often made to a county welfare department or local law enforcement, police or sheriff's department. What happens when more than one mandated reporter is aware of the or has the knowledge of suspected child abuse. So let's say your hygienist or your assistant was having the conversation with the child, became aware of the situation, called the dentist, etc. The dentist now becomes aware. You both are required to report, but you can report it on one report. You don't each separately have to file the report, all right? But you should designate one person to report this. Now, you should follow up to make sure the report was made, all right? So a single report may be made by the selected member of the reporting team, but any member of your team that has knowledge that the designated person failed to file the report must do so themselves. There are safeguards in place for mandated reporters. I am not an attorney, so I cannot guide you on the laws. But again, these safeguards are there so that you have the protection of the law. Now, again, anybody can sue anybody in this world, and we know this, right? But mandated reporters should not be subjected to retaliation, for instance. And I'm going to talk to you about a case that I was up against a few years ago. So no supervisor or administrator should come between you and filing a report, all right? If you are knowledgeable of an occurrence, you need to file the report. If your supervisor came to you and said, you know what, we've got this taken care of, don't worry, but you don't need to file this. Let's say it's something that happened that you became aware of as you were treating the patient. And let's say maybe you're working for a clinic or DSO and the director said, no, we take care of this internally, don't worry about it. You better worry about it because you're mandated reporter, you have to file it, all right? So years ago, I was practicing for Indian Health Services in a very rural location. And I arrived in the parking lot, and one of the leadership team met me at my car as I was getting out and advised me that they had added a patient to my schedule that day. She was 19, and that she had filed an abuse case in the clinic against one of the dentists who still worked there. And the dentist happened to be my supervisor. And and it was a sexual molestation charge that she had filed. So they were requesting that I seat a crown that was probably 2 years old. The case was 2 years old. Good luck with that, right? But aside from that, I now have new knowledge that this child, who's now 19, had filed a report, and I'm now required to file the report. So I went to the medical director. This person was not the medical director, and I informed them that I would be filing a report. And he said, no, we take care of this internally. You don't need to file a report. It's already been done. I said, this is new knowledge to me. I'm treating her today, and I'm going to file the report. They'll add it to your report, but I will be filing a report. He said, no, that's not advisable. We don't want you to file a report. So I filed the report, and this was around the holidays, and I didn't hear anything else. And by the way, there was no case in the lab. The tooth had been prepped. There was no temporary on it anymore. So, we had to clean it up and re-impress and send it to the lab. And I actually went to that dentist and said, would you happen to know where the case is for this patient? And he didn't even make eye contact with me, just shook his head no. So it was all very awkward, right? So I filed the report. And about a week later, on Christmas Eve, we had our clinic Christmas party at a local restaurant. Quite a bit of fun. Now, I was working in an area with public health services that I had housing, and I went home and everybody knew where everybody lived in the community. Again, it was Christmas Eve, and I get a knock on my door. about 5 or 6 o'clock at night. And it was 2 of the tribal elders there to hand me my pink slip. They were firing me because I filed the report. And so Christmas Eve, I found myself jobless, which was fine, because when I look back on it, do I want to be practicing in a situation like that anyways? And I didn't. It wasn't a safe place to be. But it was bad timing. Was it retaliation? Absolutely. It absolutely was retaliation. And again, doing the right thing doesn't always bring about the results that we want. You know, we put ourselves in this situation when we become licensees. All right, any questions or comments? So again, you cannot be retaliated against for filing a report, but you still can be. So it's part of the job, I guess. So did the dentist get in trouble, Laura? And that I never found out. My guess is that no, because he was still working there. He was still the supervisor of the dental clinic. And he was still there after I left. So I don't know if he ever, quote, got into trouble. They could have very well investigated it and said, well, we don't have enough evidence. But, and I did not call them out on retaliation. Why? Because it was their sovereign nation. And I was told that probably nothing's going to happen. It was quicker for me just to get a job and move on, which is what happened. So for retaliation, it depends on your state, what is required, what can happen with retaliation. It's a state-by-state case. But again, I was working for a rancheria on what would be considered sovereign nation, and I was employed at will. So they can just fire you for any reason, right? And that's what they did. They showed up and gave me the letter, and off they went, Christmas Eve. Okay, so again, be advised, be aware of your laws in your state. It would be impossible for me to go through every law, but we do have the resources for you. Okay, confidentiality, the identity of the reporting party and the contents of the child abuse report are confidential and may only be disclosed to specific persons and agencies. Obviously, in my case, when I filed that report, it was in a town, maybe population 1,100. So it's not like they wouldn't know at the clinic who filed the report, especially when I walked into the medical director's office and said, hey, I'm filing this report. And what was interesting too was that when I was hired, I had to sign something that said I understood I was a mandated reporter, but they were going through the process because that was required by the state. And they actually gave me a booklet on, mandated reporter. And so, que sera, sera. So again, confidentiality here is the contents are to be confidential and only disclosed to specified persons and agencies. Penalties for failure to report depends on the state. It can be anywhere from a fine to jail, excuse me. You can be found civilly liable for damages as well. And especially if the child is further victimized or other children are harmed as well due to your failure for not reporting. And any mandated reporter who willfully fails to report abuse or neglect, or any person who impedes or inhibits a report of abuse or neglect, where that abuse or neglect results in death or great bodily injury, shall be punished by not more than 1 year in county jail. And this is one state statute, doesn't represent them all, or $5,000, which to me if it results in death or great bodily injury and it's a $5,000 fine, where did we go wrong, right? $5,000. Okay, so we had a question here about feedback. Did I ever hear what happened to this dentist? And I did not, right? So I didn't hear back about the prior report, but I also never heard back from my report. And I would guess in that area, because of the land and the rancheria, that was a big family. They were well known. They were well known to law enforcement and so forth. And they hired quite a bit of employees in the area. So I think it was probably swept under the rug like the first one, but I have no way of knowing. But normally, after the investigation is completed or it reaches final disposition, the investigating agency will inform the mandated reporter of the results and any action that the agency is taking. Now, when we talk about identification of child abuse, it's important to understand that it can occur in any family, regardless of socioeconomic status, religion, education, ethnicity, or other factors. And also understand, be aware of alerts to the signs of child abuse. And it's, again, not cut and dry. So you have to be aware of almost pieces to the puzzle. What are you going to ask? How was the child's reaction? How was the parent's reaction, and so forth. So red flags for abuse and neglect are often revealed in environmental problems, parent or caregiver behaviors, family interactions, physical and behavioral indicators in the child. And we're going to talk in more detail about what a few of these are here momentarily. When we talk about environmental problems, we're basically not in that child's home. Okay, so we don't necessarily see their living conditions, but we can see what kind of shape the child's in. You know, dirty clothing, have they been bathed, etc. Have you ever been threatened for filing a report? No, just lost my job, but not threatened. Well, I guess I was threatened when I spoke to my employer years ago and let them know I was filing a report because I was doing what I was supposed to do. And they advised me that they would handle it internally. Maybe I didn't pick up on the fact that that was going to be a threat against my employment. Sometimes I'm a little slow that way. I figured they were going to do the right thing too. Again, so environmental problems, we don't have the luxury of being in their home and seeing how they live, which is very telling also. But parental or caregiver red flags, when you're treating children, parents can really cause you questions, right? Sometimes they just lack the fundamental understanding of normal child behaviors and development. They may have unrealistic expectations of the child. For example, toilet training a 6-month-old. They may have unduly harsh and rigid attitudes about child bearing or child rearing, excuse me. They may also focus on that child as being evil or bad or, quote, beyond control. They attribute badness to the child or misinterpret the child's normal behavior as perhaps evidence the child hates the parent. They may use objects to discipline the child, belts, whips, clothes hangers, etc. Or they describe the inappropriate use or extreme consequences, like locking the child in the closet or withholding meals. So again, parent lacks just the fundamental understanding of parent-child relationship or perceives the child in a negative light. They're unable to describe positive attributes of that child. They berate, they humiliate, or belittle the child. They turn to the child to have their own needs met, or they put their needs above the child's needs, or they're indifferent to the child. Larry is asking, do ATF officers get involved with child abuse cases? I understand that these agents patrol Native American reservations on a regular basis. So, Larry, that's a good question. In my case, and they do in some jurisdictions, but if you look at the history with Native American land or Native American reservations, there's a lack of sometimes communication between those agencies and local law enforcement. Let's say a child gets kidnapped by a estranged parent. It can take a long time, excessively long time, if at all, for local law enforcement to do anything because there's a lack of communication. So that's one problem. In my case, I don't ever think I saw an ATF officer. I was in a town about the size of, again, maybe 1,100, very rural. And we had a sheriff's office with one jail cell in it, and that's who I called, which was almost a block away from the clinic. So everybody knew the sheriff, right? There was a lot of, I would say, communication that occurred around that, which obviously they were able to know that it was me. But yeah, there was nothing like that. And you know, that the case here was that they were treating Native Americans and non-natives as well. And they had a beautiful clinic there. It was just mismanaged. I was ostracized after filing. I lost my job, Amanda. Yeah, I was fired. Hard to believe that I got fired. All right. So again, when we talk about children in these cases, oftentimes these are parents that just have no real fundamental understanding of parenting at all. And I'm going to talk to you about a case that occurred for me. Parent can be impaired. So depression or other mental illness, substance abuse, poverty, unemployment, lack of social support, domestic violence, parental history of abuse, or inadequate care, although it's stated that most abused children do not become abusive parents. I had a case in the same community. I was working for another public health clinic. It was my pickup job after being fired. And what was interesting about that was the clinic that hired me said, "Oh, every dentist in here has been fired by by Native Health or Indian Health Services. So join the club," and they hired me. So what was interesting for me, I had a 7-year-old little girl that came in one day who had an abscess and she needed a tooth extracted. We prescribed antibiotics because it was pretty nasty. And, you know, we're in a rural area. And her mother and father were both there. And I educated them around the fact that this was due to advanced caries and it was an infection. And in children, it can quickly turn into a life-threatening infection, told them what to look for, and that we'd have her back in a couple of days. We're going to extract that tooth. We made the appointment. So that day arrived, and by the way, this little girl was very precocious. She was very happy. She was excited to be there. She'd never been to the dentist, and she was very cooperative, very sweet, very smart little girl. So I thought, good, we'll get her back, and then hopefully we can get the rest of her needs taken care of. But that day rolled around, and I walked into the clinic. And she was supposed to be in my chair, but instead her mother was in the reception area filling out new patient paperwork. So I walked to the front and I said, you know, where is, you know, this little girl today? And they said, oh, you know, the mom didn't bring her today. She's going to take her appointment because she it was number 8. It's going to fall out and she's going to jail on drug charges with her husband, with the father. She doesn't want the tooth to fall out while she's in jail. She wants a flipper. She's afraid of getting, you know, beat up in jail for missing teeth and so forth. So she's going to take her daughter's appointment today. I said, no, she's not. She's going to go back and get her child and bring her child here. And so they brought her in the back, and I had a discussion with her. I said, look, this appointment was for your daughter, and you're going to have to make arrangements, before you become incarcerated here, but you can't take your daughter's appointment today. And so this was sort of a clue. But the other thing about this couple, when they brought her in, was they constantly berated her. Now, she was like a shining light. The intelligence and the joy that she had, she was really, again, so smart, so excited to be there. And the whole time, her parents would describe how she was bad. They even said she's evil. Be careful, don't let her manipulate you, and so forth and so on. So the whole thing collectively, you could see that there were some, dynamics in the family that were concerning, right? So they brought her back. We were able to treat her, and then we got the mom in to get the tooth extracted in a flipper. Okay, we're going to talk again about physical indicators in the child. Any questions or comments before we do? Okay, so any infant that is not ambulatory, they're not crawling yet, and really any infant with a small bruise or injuries to the back should be investigated. When infants are young enough, they're not ambulatory. They can't move around. They just lay there, right? If there's a child with a bruise, that's usually a big red flag. Or an infant with a bruise, that's usually a big red flag. So when we talk about physical abuse, it's any injury to an infant that includes even a small bruise, injuries to the back, buttocks, ears, face, especially the cheeks, neck, genitalia, unexplained injuries or injuries with improbable explanations. Bruises or burns that are patterned or have a distinctive outline, broken bones, lacerations, unexplained bruises, burns, so cigarette burns, scalding water, iron burns, any injury when there is a delay in seeking appropriate medical care. We were talking about how COVID-19, we saw delays and a decline in emergency department visits, and the children that did make it to the emergency departments often were hospitalized more than prior to COVID-19 because there was a delay in seeking care. So sexual abuse, the single most important indicator of sexual abuse is disclosure by the child. But when these children are young, these children aren't going to tell you, oh, I was sexually abused, because they don't know what's happened to them. They don't understand. When they get a little bit older, they may. But remember, we said the average age of child abuse is 3. So a 3-year-old isn't going to understand what sexual abuse is. Now, older children may not report or disclose the abuse because they've been told not to. They've been told they may be harmed. They have guilt and shame. They're worried if it's going to break up their family and so forth. And these abusers can be anybody: step parents, caretakers, clergy, as we know, etc. So we can't really look at a person and say, oh, gosh, that person looks perfectly normal. They couldn't do something like that. It's not unusual for children to delay weeks, months, or even years, or maybe sometimes not at all, from disclosing sexual abuse. Now, also, many times these children, or oftentimes, they're accused of making up a story because, again, the thought of having this adult that may be in their life abusing them is so horrific that they're thinking, that the child is using their imagination. They've made up a story. They like the victim or the perpetrator, or not the victim, the perpetrator or abuser, and they can't believe that this perpetrator would be capable of something like that. So, and oftentimes these children, when the report is filed, they'll cave, they'll take it back and say, no, it didn't really happen. I made it up, because they feel guilty and they're concerned about what's going to happen to their house and their family, right? So they recant their story. I'm going to tell you a story that happened to one of my patients. I was probably 6 months out of dental school in private practice, and we had I'm going to tell you the scenario, and then I'm going to ask you what you would do before I tell you what I did. This is a 5-year-old little girl. She was first visit with us. She was on her way to a birthday party, and I made notations in my patient notes that she was on her way to the birthday party. So the next time I saw her, I would ask her about the party. She was very excited. And she came back the following week or so for some restorative needs. And I did. I asked her, well, so how was the birthday party? And she said, it was great. She said, we had cake, there was a pony, we had a jumpy jump, we had prizes, and there was a man with a puppy. And he told me if I showed him my underwear, I would get to pet the puppy, right? So what would you do if this was your patient? You heard this little girl say there was a man who told her if he showed her her underwear, if she showed him her underwear, she would get to pet his puppy. She's sitting in your chair. You're getting ready to do restorative work on her. What would you do? Tell the parents is one. Ask her if she knew the man. Bring the parents in to discuss and then report. So Amanda, where would you bring the parents in? Into the operatory with the child, or where else? Were the parents present? Parents were not present, Larry. No. Just the child, and the dental assistant was with me. Report it, ask her some more questions, report the situation, Marlon, and tell me what you're going to ask her. Ask if she petted the puppy, report it. Okay, so here's what I did. I called my dental assistant out of the room really quick, told her, here's a prize. I need to talk to the assistant. I told the assistant, look, what I want you to do is make sure you write down everything as clear as day. So I went back in, and I'll ask the little girl, I said, so that's great. I said, so did you pet the puppy? She said, yeah, I wore balloon underwear, and he really liked my balloon underwear. Okay, that's when I went into my office, told my assistant, have her pick a couple of toys out of the prize box. Before I ever spoke to the parents, I went in, collected my thoughts, picked up the phone, and filed the report. All right. Now, there are a lot of questions here about ask more questions, talk to the parents first, ask her who the man was, ask her if he showed her underwear. The fact is that that's all I needed to hear. And the reason is this. If we start really getting into the detective thing as dentists, well, who was this? What was his name? Where were you? You might be deposed someday, and you could be blamed for leading this little girl's discussion. So all I needed to hear was, yep, I showed him my underwear, and when she went into it was balloon underwear. That's all I needed to hear. So I let her know, well, we've got some prizes here for you. I'm going to see another patient, and then we're going to go ahead and get started. Now, I went in, I filed the report, and then I called her parents back to my office, told them what I heard. Of course, they were shocked. They were inconsolable, actually. And they said, look, I said, I did file a report. I have to let you know. I don't have to let them know. I said, but I want to let you know I did file a report. And then I went back in, and I knew the police were going to come to the practice, right? So I let my front office person know, let them in the back, seat them in my office. Do not let them come through the front door. So they arrived as we were finishing up this little girl. And parents took her home, and she did great. And I wished them well. And then a couple of hours later, we go to leave the practice that day. And of course, I filed a report with the police officers. We're closing the practice. We walk out, and that family, the man, the show me the underwear man, was there with his family in our parking lot yelling at us. The family's yelling, he would never do anything like that. She made it up. She lied. He wouldn't do anything. So the fact is that when a child tells you something, they tell you something often in their own reality, right? This was within her own imagination world, but the fact was that she wasn't making it up. I don't know what happened beyond the underwear. I didn't need to know, right? I don't need to know because I'm not a detective. So you don't want to come across as leading them. You don't need to go out and talk to the parents first before you report it because you're still required. You want to keep your composure too. You want to make sure that you document very well what she said, which we did. And then we filed the report with the police. Now, the fact here is that I don't remember what the outcome was. I don't remember. Sometimes these cases, they will take the cases and put them in a file and say, well, it's inconclusive. We didn't have enough information. And when there's a perpetrator like that, it's not their first rodeo. This was probably not the first little child that he asked to see their underwear and you can pet my puppy, right? So he was a predator. So I don't know, again, what the outcome was, but that's how you handle it. You don't want to try to ask so many questions and investigate. So I just want to look back at some of the answers here. I would ask the parents to come in the room and talk to you and the child. So no, you don't want to do that. You don't want to ever put the child in a position of the fact that they don't know that anything wrong happened, right? They don't know. It's a 5-year-old little girl. So she had balloon underwear on. That's all she cared about. She got to pet a puppy. The parents can start yelling at her in the operatory, etc. So, and I totally get why you'd want to do that because you're trying to verify this. But I would caution you all on trying to be the detectives here. Ask her who was the man. Ask her if she did show the underwear. Okay. Okay, again, so the single most important indicator of sexual abuse is disclosure by the child. And again, I just gave you a perfect example where they may not tell you the straight story. They may tell you within their own reality, right? So again, children rarely fabricate these stories. We should take them seriously. It's not up to us to decide if they are kidding or lying, or it's not up to us. We have to let the investigators decide if that's the case, right? I agree with not asking more questions than necessary. If the parents are not the abusers, should they know about before or after the reporting? It's a case-by-case basis, Larry. I let them know afterwards because, to be honest with you, I was pretty upset when I heard it, and I didn't want them to see me upset, but I needed to be level-headed when I filed the report. So in this case, there was no reason why they needed to know before I reported. How did the party guy know where to find you? The parents told him? The parents did. Yeah. The parents went right over to his house and said, okay, we were right at the dentist and you know, we heard that you asked this. So were the police there when you talked to the parents? No. I spoke to the parents before the police got there. Yes, so getting confronted in the parking lot, this was really uncomfortable. And that's why, like I said, these are high stress situations. So that's why it's good to have a plan. We didn't have a plan. I was only out of dental school for a couple of months. And we didn't have a plan, but we were able to pick up the ball and go with it here. Here's a question or a comment. I find that some parents retaliate against a child for talking. Doesn't it put the child in more danger? Is there a way to report the incident while still protecting the child's safety? So I did the best I could, you know, but I wanted them to be aware that this happened to their child. I'd want to know. If this was my child, I'd want to know about this. They did not know it happened, not at all. No, it's not strange that they would let the man know where the little girl has her dental work done, because there weren't that many dental practices in town, and I was the only female. So I'm sure in the conversation, they may have said, well, we went down to this dental practice. You know, these were angry parents, very upset. So they may not have thought about what they were saying either. And the guy, you know, the party happened to be at a relative's house. I don't remember his association in terms of relationship, but you could tell he was sort of the patriarch, right? And they were all protecting him. They were all protecting him. And so the parents, I think, acted out of anger. They drove straight over there. At least the man will think twice before he does it again. Unfortunately, these predators do it over and over again. If they're really, you know, I don't have data for you, but they don't normally think twice. They just get more creative. If my child was potentially abused by someone, the last thing I do is tell them where she goes, dental school, daycare, etc. Yeah, and probably I wouldn't, but I can't judge what these parents did because they were really angry and they were really upset. They were very upset. And it could have been actually because I think they were referred by one of the relatives in their family. So that could have been why. And again, this was many, many years ago, but they definitely knew the practice. That's right, Larry. The older you get, the more you trust that little voice on your shoulder. Yep. But I think, you know, I think she was referred to us through a family member. So it could have been that she said we went to the dentist and the family member said, oh yeah, it was this practice, you know, up the street here. It certainly wasn't the police giving that information. All right. So again, at the end of the day, children rarely make up these stories. And if they disclose something like that, you have to report it. You don't have to investigate it, right? So, okay, let's talk here about a little bit more information about neglect. Possible symptoms of child neglect are often difficult to identify because they're less defined than those of physical or sexual abuse. So again, we're not in their home. We don't have that luxury to look around. But remember that we should evaluate each situation on its own merits individually in the context of that family's culture, values, and economic situation. So there are behavioral indicators that we can rely on, and we're going to talk about that here in just a minute. As a hygienist, would you go to the police or to your dentist? Whitney, can you clarify that for what? let me know why you're going to the police to file a report, or that you've become more aware of a situation. Yeah, just go ahead and type it into the chat area, and I'll make sure I address that. Okay, so reporting laws require a report to be made when the mandated reporter has, quote, reasonable suspicion. And judging what constitutes reasonable suspicion in your practice can be difficult. So rely on direct observations of children and families to determine when a report should be made, when you are absent of clear physical indicators or verbal reports. Okay. And again, it's not black and white. So you will collect information, but that's different than investigating, than being detectives. I was going to say Dick Tracy, but I'd really be aging myself there. We don't need to be Dick Tracy. We don't need to be detectives, the Pink Panther or whatever. But we do need to be really cognizant of the communication. Listen to the children, because it's all there. Children don't have filters, right? And obviously this little girl who was just chatting it up to me about the birthday party, had I not asked her about that birthday party, I would have never had that information from her. I would have never known that happened to her, right? If I were you and she told me, the hygienist, should I talk to the dentist before filing the report? I think it's a good idea to let them know that you will be. And you should let them know that the event occurred, the communication. And they may join you in the report because now they become aware of the information. So I think it's always a good idea to let your practice know what's going on. Okay, so again, when you're evaluating a concern, it's important to maintain a clear distinction between determining whether there are grounds for reasonable suspicion and therefore filing a report, and conducting a full-fledged investigation of the allegations. So only a child protective agency or law enforcement can conduct the investigation, and you don't want to get in the way. You know, you can really become involved in something, and it could be detrimental to the victim down the road. So you don't want to give the perpetrator any reason to have an out. Record what that child has to say verbatim, and don't ask them leading questions. Okay, so Albert wants to know, if the child had advanced rampant caries before the parent never brought, because the parent never brought the child to see the dentist, would the parent be considered child abuse? And we're going to get there, but I'm going to go ahead and give you the spoiler alert. So what we did here at the county, and what you're really supposed to do, is educate that parent first. Let them know how the caries occurred, how it can cause life-threatening infection. Gosh knows, here in Maricopa County, I saw so many of these cases, all 20 teeth, ECC, multiple abscesses, and so forth. What do? We educate the parent to let them know this is a disease and the child needs to be treated. This is infection. It's not good for them. It can lead to a life-threatening situation in a child very quickly. And it can be painful, and it can interfere with their school. And so forth, their learning. It can interfere with their hearing and their speech, and so forth and so on. So we need you to bring the child in regularly, and we're going to take care of this. We want you to work with us. Now, when they hear all of this, and you write down in the chart that you explained this all to the parent, and they don't bring the child back. And in our case, when they don't bring the child back and we have arranged for transportation, either through the county or Medicaid, or we have other nonprofit sources here, Native Health and so forth. If they don't bring the child back after you've explained it to them, that's a report. That's reportable in our eyes. We've educated the parent. We've told them, and do you have any questions? Do you understand what I'm talking about today? Do you understand the importance of this? I do. So we can have you bring this child back. Yes, I will. They don't bring the child in, that is a report. Now, here in Maricopa County, we worked with the early, it's called EPSDT coordinators here. So they're through the state, and they coordinate these child cases of Medicaid with providers. So every day at the end of the day, we'd be faxing like 200 exams to them and the outcome, and then I'd get calls back. This patient has not been seen. Are you going to report it? And I would say yes. So I have to report these neglect cases. We had a case of a child with a craniofacial defect, and they were, I guess, on the lam for a while, but he had Medicaid. He was about 4 years of age at that point, and the state lost touch with him. He had not had his immunizations up to date. He had not been seen for the craniofacial defect he had, no pediatric visits. So this is a way they could coordinate all the cases, and certainly the dental care. And they said, Dr. Rowling, can you make this report on our behalf? And I said, absolutely. So those are severe neglect cases. Juliana, when you say bring within how long? So you mean after we visit? Well, whenever we make the appointment for them. So, with the county health department here, it's so huge. We'd have to coordinate with the state transportation. So let me give you another example. We had a grandma. Well, first we did an evaluation out at, it was a WIC center or immunization. And 2 little babies, one probably 18 months old or so, maybe 20 months, and then a brother, and they were tiny, and they both had rampant decay. And the mother was there at the time when we evaluated them. Now, the mother said that she would bring the children in. So we started the case and case management, and we were able to get transportation. And then they didn't show. And it was with a local pediatric dentist. So when they didn't show, the state called me back, and I said, well, we're going to need to file a report. So we filed a report, and it turned out that the mother ended up incarcerated, and the grandmother now had custody, and the grandmother did not have a car seat. So she was not able to use the transportation. She didn't have car seats. There were 2 little ones. So we actually became case management for them to get them 2 car seats through the county health department. So these cases are really complicated. And I tell folks that, we are really focused on teeth. But by the time it gets to teeth, you've got a whole world of complexities that are going on with that family. And teeth are really symptomatic physically of what's going on within that family dynamic. So we were eventually able to get these 2 little babies to the pediatric dentist for evaluation, and then get them taken care of. But it was a lot of work and a lot of coordination. So bring within how long? So again, you make an appointment, and if they don't show, that is, and they've been fully informed of this, then that is neglect, right? Had another case at another clinic. This was a 10-year-old girl, diabetes. She was in my operatory for an emergency visit, toothache. I walked into the operatory. I looked at the chart. I could see she had failed 4 appointments. And this preceded me. Walked into the operatory, and her sister, who's a teenager, and the boyfriend are standing there. Mom nowhere to be found. And the sister said, my mom is really sick and tired of bringing my sister in here, and nobody does anything. I said, well, let's get your mom in here so I can have a conversation and have you 2 wait out in the front. Please go get your mother. So mom came in, and I said, look, we've had 4 appointments. Well, all you do is give her antibiotics and nobody does anything. I said, you haven't showed up for your appointments. I said, it's right here. I said, so here's what I'm going to do today. I'm going to give her antibiotics, and you're going to bring her back a day that works for you. Go up to the front. We need her here by Friday at the latest. I said, and if she doesn't show this time, I want to inform you that this is going to be considered neglect. So we need to have her back here. And she was Medicaid, so we had a way to follow her and follow the family. But that was sometimes you just have to take the bull by the horns here and say, look, the BS is done. We're done with the BS time here. You need to bring your daughter in for treatment. She's 10 years old. She has diabetes. This is a serious infection. We can't manage this way for her anymore. It's dangerous. So there is a question, what if you educate the parents, but they said, okay, but maybe they didn't have the money to do so? And that's a very valid point. So depending on what setting you're in, okay, but you still file the report and let Child Protective Services or whoever their designee is, they may find out that the parents don't have enough money. They might be able to get resources. What if they don't have enough money, but they qualify for Medicaid, right? So it can get them into resources. You still are required to file the report. From Kira here, we had to report a family for letting their daughter have an abscess and not pulling the tooth because it was a baby tooth. The daughter ended up being hospitalized because the infection spread to her head and neck. The mom had no idea how serious those type of infections are. She ended up being fined, right? So again, with oral health, the problem that we have here is that oral health may be the last thing on their list of priorities. Mom going to jail, or a parent who has enormous medical needs and may be very ill. We don't have the capacity to be case managers. And oral health in these clinics require case management. And so even, in private practice, you're trying to navigate something that's really very complicated. So if they don't bring the child in, then it's going to be a report, and then let the professionals decide what the reason was. Okay, always important to consider cultural considerations. So you have to really put aside your own beliefs and biases, understand the cultures that are in your community. And I will give you an example here. I was working for a nonprofit, and we were treating refugees with IRC. And we had a group of Somalian refugees that we were assisting. And so I was the director of the program, and I met with the IRC and their representatives. And there is a practice in Somalia where the canine teeth of young boys, 12-year-old boys, are removed. They're extracted, and they're not extracted with forceps. They're extracted usually by a tribal elder or someone like that. Very traumatic, very painful. It's a ritual. It's a rite to passage, right? And these young boys grow up with a specific dialect, and it affects their speech. So here in the US, many of them that came here to the US, they grow up later and they want to be employed, and they have missing teeth, and they're trying to get implants and so forth. But the boys that don't or didn't go along with it, they would be badgered and bullied within their community. They were called goat teeth because they wouldn't have the teeth extracted. And so that's important information to know when you're working with the community. What are their cultural practices? If you see this, you'll have a little bit better understanding. In some cases, we would see these children, and this, by the way, these were their permanent canines. Once they started coming in, they would remove them. But sometimes we'd find, tooth fragments and so forth, because again, they weren't using forceps in sanitary conditions. All right, so cultural considerations then. When do you file a complaint, right, for something that is abusive? Well, if it's a cultural consideration and it's considered abusive in this country, then you have to file a report. But I would tell you, contact your child protective agency also and find out what's going on in your community as well. If you know that somebody is has some cultural practice, find out if they've had a problem, here as well. Be aware. Okay, when you talk to the child, you're going to observe their physical signs, their behavior, verbal disclosure, and you don't want to ask leading questions, right? So you're going to ask open-ended questions. How did you get hurt? Wow, that's a big bruise on your chin. How did that happen, right? Rather than, did your brother hit you? Who hit you? That's the difference. Open-ended questions. If it's a child behavior that concerns you, ask the child privately whether there's anything going on that is making them angry or unhappy. So quick story I have for you. I was practicing in a public health clinic, treating a boy who was probably, I'm going to say he was about 8 or 9 years old. Always very cooperative. He needed quite a bit of restorative work. And he came in this time for more restorative work, but this time he was very uncooperative. And I mean, I had been seeing him several times. He was crying, he was moving his mouth around, he didn't want anything to do with the dental appointment that day. And I took Mom aside and I said, what's going on with him? And she said, well, his father was killed last night. His father was shot and killed last night in a parking lot. And he's very upset. And I was just mortified by hearing this. I was upset. And I said, my gosh, well, why did you bring him in today? Why? And she said, because if I didn't bring him in, if we didn't give notice, I can't bring him back. So that is the policy in this clinic. They had a no-fail policy. You couldn't fail an appointment. You couldn't cancel an appointment at the last minute. And she knew it was taking months to get him in there. So she dragged him into the dental clinic that day. And those are the unintended, consequences of these rules that we have sometimes, where it ends up being detrimental to the children and adults as well. Okay, so again, we said talking with children, sometimes verbal disclosures can occur by accident, and I just relayed that story to you. And oftentimes the child may recant their story later because they're trying to protect their family. Okay, the setting when talking to children here, conduct a discussion in private. You want whoever brought them in to be in a room away from the child, and they cannot hear the discussion, which is, again, why you need a plan. You don't want that parent or person, whoever it is, hanging out in the hallway where they can hear the discussion. So what do? Well, normally you have to take x-rays or you need to take photos. Have them go to a designated place. So if you have a child that's coming in with an injury, have this set up ahead of time. Maybe the reception area, so everybody should be on the same page. That person's going to go sit out in the reception area, and you let them know, radiation, we can't have you in here. We're going to have you sit out front. Have them escorted. Make sure somebody's keeping an eye on them. When you're talking to the child, sit next to the child rather than behind a table or a desk, and talk to the child at the child's level. Talk to them away from, again, the suspects or parents or anybody else who might be influential and who could try to dissuade the child. Always manage your own emotional response, and let that child tell you of their experience in their own words. Again, refrain from asking leading or suggestive questions. When we're evaluating a child with injuries, we must always be aware of the possibility of abuse or neglect. It should always be in your differential diagnosis. We can't look at the parents and say, well, they look like nice people. You know, yeah, he probably did fall off that bike, right? It should always be included in your differential diagnosis. So a delay in seeking medical care, changing stories as to how the injury is sustained, or the stories don't corroborate, or it's an implausible explanation, should always raise your level of suspicion. And when determining whether an injury was accidental or inflicted, we should consider the following. And I'm going to tell you before I do that another story. So again, right out of dental school, I'm in private practice. And on one day, I had two little boys that came in that had fallen on their faces. The first little boy was on a skateboard, and we were right next to an elementary school. And the school nurse called and said, you know, he came in, he fell off his skateboard, and he was probably 7 years old. She said the tooth is very mobile. So they got him to me right away, and the parents came in, and the story corroborated, you know. But later that day, we had another little boy that came in about the same age. The mom called and said the father would be bringing him in. He apparently fell out of the dad's truck, or some story as such. And he came in with a similar looking injury, but there was something about the conversation I had with him versus the father that didn't add up. When I got his story, it was clear that he got the talking points, and the dad didn't want to leave the room. Okay, the dad didn't want to leave the room. We had him go out so we could take the photos, take the x-rays and so forth. But the little boy said, well, it was this elaborate story that you could tell that he was trying to make sure that he was covering all his bases here. You know, fell out of the truck, his face hit the tire, and then, you know, et cetera, et cetera. The dad, it was very basic. Oh, he just, you know, landed on his face. And it had nothing to do with the truck. So that was a report that I filed, and that was a report that I was correct on because it wasn't dad's first time abusing his kids. All right. Dental neglect is defined by the American Academy of Pediatric Dentistry as a willful failure on the part of the child's parent or caregiver to seek and follow through with treatment necessary to ensure a level of oral health essential for adequate function and freedom from pain and infection. So medical neglect, dental neglect should be reported in order to give these agencies the opportunity to assess the situation and determine the appropriate response. Okay, children with disabilities are at a much greater vulnerability for abuse. In a national study in 1993, researchers found that children with disabilities 1.7 times more likely to be maltreated than their non-disabled peers. And Sullivan and Knutson in 2000 found that children with disabilities are 3.44 times more likely to be maltreated when compared to children without disabilities. So be aware that children with behavioral challenges may be at higher risk for physical abuse. Caregivers may have unrealistic expectations, they become frustrated and so forth. How to decide whether or not to report suspicions of abuse. We spoke about reasonable suspicion. Again, I want to reiterate, hard proof is not needed to make a report. You do not need the full answer here. Verbal disclosures of abuse should always be reported. Even if you think the kid's making it up, you still have to report it, okay? We spoke about Dr. Kemp earlier here, and it's important to note that mandated reporters are immune, usually pursuant to statute if they make a report in good faith. Again, I'm not an attorney, so you'll need to check with your own state statute. Can you make a report anonymously? Usually in most states, if you're mandated reporter, you cannot legally make an anonymous report. You have to identify yourself. Again, what if the abuse occurred in the past? So there's no time limitation regarding the reporting of child abuse. If the victim is under age 18, the abuse must be reported. Now, I spoke to you about this patient that I saw when I was with the Indian Health Services. She was 19. I still reported it because I wanted to make sure they had my information in the file. I wanted to just cover my bases, right? And it depends on the state. So if the child or if the adult is 19 and somebody in a healthcare setting like that comes to you and tells you that they filed a report and they were over, according to this report, several years being abused by this one person, I'm still going to file a report and say that it was brought to my attention by the clinic that this was reported and that I was the treating clinician this day. Okay, is parental consent required to take photographs or x-rays of suspicious injuries? As long as you are focused on that injury, not usually. Again, it depends on your state. Now, we spoke about contributing factors to abuse. It can be substance abuse, stress, lack of support network, domestic violence, poverty, learned behavior, perhaps. And this is why it's important when there's a lack of support network that you do report it, even when they may not have enough money. And that was ultimately why they didn't bring the child back, because some of these agencies can help them get the services somewhere. It may not be in your practice, but they may be able to get it in a clinic where they can be treated at no charge, or etc. Indicators of possible child abuse: patterned bruises, patterned welts, bite marks, tattoos, lacerations or abrasions, burns, fractures, head injuries. Again, unusual patterns. Any sort of pattern injury is suspect. And the pattern injury, this is a belt buckle, so you can kind of see it on the back there. Slap marks, so those are hand marks. When we look at bruises, again, young infants with a bruise should always raise concern. And areas that are commonly bruised are the bony prominences. So the forehead, the chin, the knees, the shins, the elbows. If you see bruising on the face, the ears, the neck, the abdomen, the buttocks, and so forth, those are not common areas. Those are not the bony prominences. Why are bony prominences is important? Because children play, they're social creatures. They fall, and they are going to fall on a knee or an elbow or the palms of their hand. But if you see bruising or injuries on the back of their hand, those are defense wounds. They're covering, they're protecting themselves. Okay, dating of bruises. As you know, bruises change colors as they heal. So when you look at these cases, this is a bicycle accident reported. The parents claimed he had a bicycle wreck. And when he came back 2 weeks later, everything healed at the same time. Again, you don't want to wait 2 weeks to see if he heals before you file a report. You're going to take other information into consideration. But this was a child who also was reported as a bicycle wreck, but had bruising at different stages on the face. So this represented multiple injuries at different times, right? And as it turned out, the father had been beating her. Sharon wants to know, if you have an adult that has special needs and parents bring them to your office and they need a lot of dental work, but don't always bring them in, can you report them if you feel it's necessary? Yes. So I'm going to refer you to your own state laws. That gets complicated. Also, elderly as well. Elderly that have power of attorneys or fiduciaries, and you identify dentistry, which this is focused on children for now. But yes, and again, you don't practice in a silo. You can pick up the phone and call your local law enforcement agency or Child Protective Services and ask them. Okay, so again, typical areas for bumps and bruises as we look here, the bony prominences, and you're going to see this on your quiz, elbows, palms of the hands, chin, knees. Typical sites of inflicted injuries of child abuse, buttocks, lower back from paddling, genitals, inner thighs, slap marks of the cheek, pinch marks of the earlobes, forced feeding where you'll see frenum tears or upper lip tears, and then the neck choke marks. The Academy of Pediatric Dentistry, so this was the breakdown for you of dental injuries. Missing or fractured teeth here, 32%, oral bruises, 24%, oral lacerations, 14%, and jaw fracture, 11%. And these were dental aspects of child abuse and neglect. This was Native American Tribal Council photo. And this local tribal council decided to define baby bottle tooth decay as a form of child abuse, not neglect, because it is a direct result of actions that were taken by the parent. So I can tell you the number of cases we saw like this at the county here. We have a relatively large population of Native Americans here in Arizona. And these cases, unfortunately, not just Native Americans, were just prolific in our patient population. And these cases too, I can't tell you how many of these cases I referred. So again, if you see a child like this and you educate the parent and you tell them, look, this can quickly become a life-threatening infection for your child. We need to get your child in right away. We'll help you with transportation. We're going to get you to a clinic and they're going to treat your child at no charge, and they don't show up for that appointment. That is going to be a report. All right, so this course did not include human trafficking. However, we do offer it on our website, and it is a 1-hour course. It deserves really an hour at least. So if you go to the link there, you'll see, I think it's around the 20th of this month. Don't quote me on that, but it is coming up this month. And any questions about the information I just covered? Okay, so Larry wants to know, what about a very disobedient teenager who attempts to get back at parents due to normal and accepted methods of setting parameters and discipline? Do we have to see evidence of abuse? Well, what would be your rationale for reporting them? So are you saying the teenager was abused, but they're also rebellious at the same time? If you believe the teenager is being abused, and I'm going to preface that by saying that teenagers get abused, and there is sort of a belief that they're older, they knew better, they're rebellious, etc. But the fact is that if you believe they're being abused, you have to report it, even if they are pains in the butt, even if they are rebellious, even if they, for all intents and purposes, they're just disrespectful. If you believe that there is grounds for abuse, and both can occur, Larry, at the same time, it's not up to us to decide if it's abusive, right? So if you have concerns, you have to report it and let the professionals decide. So I'm not sure if I read that correctly or not, but teenagers are the most overlooked population, the ages of all children that are abused. And it's oftentimes for that reason we think, well, they're just, really rebellious, and some people think, well, they really had it coming or whatever. So again, you do have to report it. It's not up to us to decide if they're being abused or not. You all are very welcome. So if you do have any questions, be sure to reach out. There's the email right there. I am going to close us all out if there aren't any more questions.